Oh. So. It's just counting.
We'll try to fix it when we're done.
That's right.
Start the meeting.
Okay, are we ready to go? Chief McEwen, could you turn the volume off on your computer?
Just did it.
Okay. I realized we were getting an echo. I'd like to call to order the Public Safety Committee meeting for June 16th, 2022. Welcome to everybody. And I see we have Jen Olin back, fresh from the FBI Academy. Welcome. I hope you had a good experience. Go okay?
Yes, absolutely. It was a once in a lifetime experience. I learned a lot. I appreciate the opportunity to go.
Maybe we could hear a little bit more in the sheriff's report.
Absolutely.
That'd be great. And we have a special guest star with us today. We have Chief Harlan McEwen. And I'd like to get to him early. I think we'll do that as part of Chair's report. But before then, we have public comment. Is there anybody who wishes to address the committee? I see one person out there who's filled out a blue card. Have you turned in the blue card or? Yeah. Okay. Why don't you come up and talk to us?
Good afternoon. My name is Zach Wynn, and my question is for the sheriff. All right. Sheriff Osborne, you've spoken in the recent past about the unprecedented manpower shortage at the department, the likes of which you have never seen. And I'm curious if this situation has improved at all. I recall that 8 sheriff's officers had left the department. And I'm also curious if you have suffered any more losses subsequent to that at the department. And I'm also curious if any officers had laterally transferred into the sheriff's department or if you were still at 0 lateral transfers. I yield the remainder of my time. Thank you.
Typically, Sheriff, we'd have you respond during Sheriff's report, but if you have a quick answer and you wanted to give it, I'd give you a moment to do it now, if you wish.
Yeah, sure. Thanks, Rich, and thanks, Zach, for the question. Yeah, we did suffer some pretty dramatic staffing losses on our road patrol. Our road patrol now is completely restaffed, fully staffed, although we do have just a couple in the academy. And to the second part of your question, we have seen a small uptick in lateral transfer applications. And we actually, 2 of our recent hires within the last month or so have been lateral applicants from other areas.
Okay. Is there anybody else who wishes to address the committee, either on screen or in person? Okay, seeing none. We'll proceed. Any changes to the agenda? As I indicated, we were going to have a short presentation from Chief McEwen. We'll do in just a minute. But before we get there, if I could ask for a motion to approve the minutes of May 19th, 2022. Veronica moves. Mike seconds. Thank you. Any questions or comments on the minutes? We ready to vote? Mike? Veronica?
Yes.
And the chair votes yes. Okay. Yeah, chair's report. As I indicated, we have Chief McEwen with us, and I believe he's here to talk about the ES chat system that we put some money in our budget to help fund this this alternative communication system. And I'll turn the floor over to Michael and Chief McEwen for a minute to talk to us about it.
Thank you, Rich, very much. Appreciate the opportunity to come here finally to actually do a live demonstration. We're very excited about some of the partners that have already come on board that have allowed us to start to beta test the technology. I really don't want to steal any of the chief's thunder, but I just really would like to publicly acknowledge the efforts that he has put into helping to get this program off the ground. We're really excited about it. It is absolutely visionary, and I think it's going to be a great asset to our community. So without further ado, I'd like to turn it over to the chief and help where I can.
Oh, thanks very much, Mr. Chairman. And this committee was aware last year of our efforts to implement this system and was very supportive in putting, let's see how this works. I know. How do I, Rob, how do I advance the slides? There it goes. So we talked a little bit about what this is all about. It was very brief, but I'm going to go over that just quickly. So the Enterprise Secure Chat is a new technology using broadband technology. What it allows for is direct communications using broadband technology, using using a mobile phone. It also allows for us to set up a gateway at the Department of Emergency Response to connect certain county radio systems. So right now, for instance, we have the county police channel, the city police channel, the county fire channel, all hooked up, and Bang's radio is hooked up for their own internal communications. We intend to have other channels hooked up, and we have equipment that was ordered under the grant, which I'll talk about later. And we've been waiting patiently since February for that equipment. As you know, the supply chain and various kinds of products is very slow, and we're waiting for those to be delivered. So this is basically a push-to-talk solution. It's just an extension of telephone, a mobile phone call. So if you think about it, and I see the district attorney's on, and I have been trying to schedule a call with you, sir, to brief you on how this works. And hopefully we'll do that in the near future. But just as an example, this is basically an extension of your phone capability. Instead of dialing up a 7-digit or now a 10-digit number and calling somebody and talking to them, this allows you to just select the person that you want to reach, and then you can push to talk. I'll show you how that works in a minute. That's the concept of this, and this is designed for government, business, public safety, and other kinds of things. We are unique in this county because most of the ES Chat users in the country are individual departments. They're a police department, a fire department, an EMS, an ambulance, the big ambulance company, I think it's AMB or one of them. They're using it nationwide, and this allows you to talk, by the way, anywhere in the country with this device, as opposed to when you're here in the county, you can reach the county radio system, but when you get outside of the radio footprint, say you get over towards Cortland into Onondaga, you lose that radio connectivity. With this system, you can still talk on the radio channel wherever you are in this country. So that's kind of the basic. These screens are intended, I was going to try to do a live demo, and Rob and I worked on this yesterday, and we found that we couldn't quite do it with the Zoom and the in-person meeting. It became complicated. So I did a couple of screenshots. If you look on the left, this is typically what a contact list, it's just like your phone contact list. You'd have a contact list. We have numbered the people in this system to coincide with the current radio numbering system for police, fire, and EMS, and we've established numbers for people that are not traditionally on the radio system. So like in the Department of Emergency Response, those numbers are all 55 numbers. You see Mike Steitley, 5561, Deputy Director Jessica Verfus, and so on. The sheriff is currently on this system, as is the undersheriff, Jen, and their numbers are 1201. And we use their numbers plus their names so that it's easy to recognize for people. So they're in the 1200 numbers. The chief from Cuga Heights and the sergeant, they're 121, 122 as example. So these are a few people that I have on already as we're doing a pilot. Justin Van, who is the kind of like the fire coordinator for Michael. He's 5563, but as an example, he also is a lieutenant in the Trumansburg Fire Department. So he would use his 1865 number when he's on a call with Trumansburg. So just to give you a sense of how we manage the numbers. So if you want to talk to one of these people, you click on the name and that push to talk at the bottom, which is right now activated, would light up like it is now. And then you just push the button at the bottom and you can talk directly to that individual one-to-one. Those calls are just like making a phone call. Instead of having to dial a 7-digit number, it's just the fact that you can push to talk and talk to them directly. It's a quicker system that the public safety people are quite used to, rather than having to make a phone call. If you want to talk to 2 or 3 people, I'll show you how that works. You can do groups. So over on the right are the channels that right now that I have on my phone as an example. It doesn't show you the whole list. But as I said, we have the county police radio. We have the county fire radio. We have the Ithaca PD radio. Those radio channels, the way they work is there's a mobile radio up at door in the radio room hooked to a gateway. And that gateway just merely allows you to talk from your phone on those radio channels, just as if you had a portable radio that costs $3,500 on your phone. It doesn't just cost.
That you already own.
Yeah,
Yeah.
it's already up, you already own it. And for the district attorney's edification, particularly, any radio traffic that is transmitted on those channels is recorded to meet the requirements that the district attorney and the criminal justice system requires. So they're recorded, so it's no different than you would be if you were using your portable or your mobile radio.
Chief McEwen,
Yes.
can you speak into your microphone in front of you, please?
Oh, I'm sorry.
That's okay. It's just a little quiet for people at home.
Okay. Can you hear me now, hopefully? I'm sorry. I forget that I'm not talking just to the people here.
So just if I could interrupt for a
yes,
second. So
please.
if you want to talk to, say, the Sheriff's Department, TCSD at the bottom,
Right.
you just hit that button.
Yes, and that's a talking group. And that is, that would include everybody in the sheriff's department that's on this system. So if the sheriff or undersheriff or a lieutenant or somebody in an important event wanted to talk to every one of their people on ES Chat, they just press that.
And it would get everybody in the
get everybody on
1200s.
that talking group.
Okay.
Yeah.
Okay.
And that's not broadcast on a radio system. That's just like, that would be like you do a conference call with a phone. The difference is that it's instant and you don't have to dial up, you don't have to select, multiple people and then dial all of them and get them on a conference call. So it's the same principle, except that it's a easier and more, they're more used to this kind of communications. So that's kind of the concept. The benefit of this is, number one, everybody pretty much carries a phone today. And they don't all these firefighters and police officers and so on carry one of these portables. When they're on duty, they probably have this with them. And when they're on a call, they have this. This is what we want them to use because they're more powerful with the power in the area on the radio system. And they're ruggedized. And so this is the preferred device to use for major events, fires, police events, and so on. But as Justin Van mentioned the other day when I was talking to him, one of the Trumansburg assistant fire chiefs was driving from Trumansburg into the city a couple of weeks ago, and he came upon a pretty serious motor vehicle accident up near the Perry City Road. And for whatever reason, he didn't have his portable radio with him. And if he'd have had this on his phone, he could have talked right directly to dispatch and relayed what he saw and what he needed. And it would be, you know, a much improved enhancement to communications. This system is really very inexpensive. The cost per user is $4.57 a month, slightly less than $55 per year per user. Let me kind of go through a little bit. Rob, can you get that screen off? I don't know how to get that off. Do I have to do that? Oh, I did it. Okay. I see how to do it. I want you to be able to see the, yeah. I'm going to move that out of the way because I want it. Okay, good. So I want to just give you a sense of where we are financially with this. You already have had a kind of a report, Rich, to the committee a year ago about this. So working with Michael, I was able to obtain a very generous benefactor who donated $60,000 to begin this project to the county. That benefactor wished to remain anonymous. So the money was passed through the Tompkins County United Way, and who then passed the money on to the county. That's now in the county budget, or however the term is. So that money now is in the doer budget. And basically that $60,000, $32,000 is for the initial radio equipment that we've ordered or have on hand, and the gateways to hook up the radio channels. So we had to have money for all that. So that's a one-time expense. And then the rest of it, we're basically assigning to 255 ESChat users. And we're doing it for 24 months purposely to allow you and the county to allow us to get people used to this, see if they like it, if they support it, and how we're going to finance that in the future. If you think about it, half of that would be what it would be for a year. So it would be for that number of users for a year. It's pretty cheap. It's, as you know, these portable radios cost about $3,500 each. So the cost of this is really minimal. And what it does is it allows us to include people that don't normally have these radios or need them. For instance, one of the departments that we like to include is probation and parole. And I think Dan Cornell is on the call here today. And they don't have two-way radios now connected to the county system. This would be a very inexpensive way for them to have connectivity to the county dispatch, be able to talk with each other, and to be able to manage their affairs. Does that make sense?
Yes, yes.
So that's the grant budget. And these are kind of a sense of who would be involved. Right now, the Sheriff's Department, and by the way, we don't have enough money for every sheriff's deputy, every Ithaca police officer, every village police officer. What we've done is we have selected people that are involved in emergency response in groups. For instance, the head of each agency and the deputy, the sheriff and the undersheriff in the Sheriff's Department case, Kyle Koskinen, the lieutenant who kind of runs the daily operations, and then certain selected people that are on the crisis negotiation team, both in the Ithaca Police and the Sheriff's Department. I think there's maybe a couple at Cornell on that team. They will all have a group together that they can talk. So there'll be selected people. The Ithaca City Police the same way. Their special response team, formerly called SWAT, and they have people on the Sheriff's Department and so on. They'll all have a group channel to be able to, when they're working together, need to talk quickly, they can do that. And all of their sergeants, lieutenants, and investigators. Same way with the sheriff to go back. So all the sheriffs, sergeants, and those specialized people, that's about as much as we could afford. And we'd like to probably, enhance that, but we want to get them using it first and get good reports. The TC3 Public Safety, New York State Police, the State Park Police, State ENCOM Police, all the county fire departments, again, would be the fire chief, the deputy chief, assistant chiefs, and their EMS squads. If they have an ambulance squad or an EMS squad that responds, that would be all we could afford. If the individual firefighters start to see this and want to be a part of it, it's $55 a year for them. And we have a capability for them to access through the door a portal where they can just use their credit card and buy a year's account, and they can be on the county system, which we will manage. They won't be on their own. So we have a way for people individually to join if they want to, before we, decide on the total budget implications. Bangs Ambulance, again, selected supervisors and people. The Department of Emergency Response. Hugo Medical Center, they're very interested in this. They have, as an example, I think they have a number of mobile phones that are in the emergency room that selected supervisors pick up at the beginning of each shift so that they can reach them if there's an emergency. They would like to probably implement this and have this so they could push one button and talk to all 8 or 10 of those people just like that, or individually. It would be a much quicker way. And so they see the value. We're still in discussions with them as to exactly how to do that. And we have budgeted a couple of accounts to get them started. And they'll have to pay for additional accounts if they want to do that. The mental health mobile crisis team, I've been in meetings with Harmony Freelander. They have right now 4 FirstNet mobile phones assigned to their on-call people. And they would like to implement this on those 4 phones. Again, a much enhanced, better way for us to be able to quickly talk with them in an emergency. Many others. We just hooked up the U.S. Coast Guard Auxiliary. For instance, we have 4 people assigned this summer on the lake that have now direct contact through the county dispatch on the county fire channel. So, and they've already used it for an important communications and non-emergency list just this last weekend. So I think you can see our vision is that we would probably include other public safety related entities like the Salvation Army, who sends a van sometimes to support the fire departments when they need food and stuff. Yeah, the Red Cross, a number of different other agencies that have traditionally no other communications than to make a phone call.
Right.
So I think the vision that Mike and I have is a really forward-thinking vision.
I agree with you. And I don't mean to interrupt, but
No.
seeing the slide here, it sounds like you're rolling it out right now. So the 24 months has started.
That's right. We started, and the way we're doing this, just so you understand, to save our money, is that we issued a purchase order for all of the accounts to ESChat with a stipulation that we will send them a letter of authorization to activate X number of accounts at a time, like 40 at a time. So we sent them an authorization list for 40 accounts. And on that date, 40 accounts we start paying for. And they will go 24 months from that date. And it's rather than paying for 200 and some when we're not using them all. So
When do you anticipate full rollout?
Well, I'm doing it individually. I'm managing it for Mike, and it's slow. And the reason is that this is a very unique thing. We have to when you activate a person, say say the Dryden Fire Chief, let's give you an example. And he wants to be able to contact the Groton Fire Chief or he wants those contacts on his phone. We have to consult with each person and know how the associations they want. That has to be managed individually rather than just putting everybody on and having a big mess. So it's taken a little bit of time. We just, we got a loan of a radio from Cuba Heights Fire Department to put the county fire channel radio up just a couple of weeks ago. So we're going to start implementing some of the fire departments. That's why we've been waiting on them. But it's going to take, I would say, we should have most of them by the end of the year. I don't want to promise it because I'm doing it as a volunteer. And it really takes a great deal of thought and discussion with each of the groups of users, the police chiefs, the fire chiefs, and
Sure.
so on.
Okay.
Just so you have a sense.
So more news to come as it rolls out.
Yeah.
Okay.
And then, so as you can see right now, I've got 28 people activated. That includes, so let me explain. So the sheriff and undersheriff have the capability of talking on their county radio channel. They also have the capability of monitoring the Ithaca Police radio channel. They wouldn't talk on that channel. They could do that on their portable radio. They have that capability. But so that they can, when necessary, be in touch with things that they might get involved with. Same way with the Ithaca Police Chief, John Julie and Vince Monticello. They have the city police radio channel, transmit and receive, but they can also receive the county. So all of this has to be carefully managed as we activate each person. We make these decisions, and I think you would understand. You know, I'm a manager, and I'm used to kind of doing that.
Okay. All right.
So anyway, the last thing I wanted to mention was the fact that some of you are aware that the Special Olympics, the New York State Summer Special Olympics, is in Ithaca next week. Quite candidly, Mike and ultimately me and the other local people weren't notified very early on about this event. We didn't know about it till early May. And is it okay for me to explain? So they requested of Mike that we provide them with 50 portable radios for their staff. And we explained to them that, first of all, the county doesn't have 50 radios to give them. And what happened is when I was police chief, you know, back in the 90s, late 80s and 90s, we had a local committee that raised money to pay for services. One of the things we did was we rented 50 portable radios from Motorola. That was paid for out of money from local business contribution. And we didn't have any of that to do. So that led us to looking at some other options. There's a little device. It's a very nice device. Hopefully people can, I don't know if they can see this on their screens on the Zoom. This device is a Sciata SD7 device. It's a push-to-talk device. It's a broadband device, not a radio device. And it can have multiple channels. It has some limitations, but this device costs $400. And we were able to get ESChat to donate 50 user accounts for the Special Olympics as a charitable contribution for this event. And they also got Sciota to loan us 50 of these devices to hand out to their staff next week. We have those now in hand. We've inventoried them. I'm going to be taking them up to Ithaca College for issuance. These are a unique device. Normally, I don't like them for public safety because I want them to have it on their phone because they always have their phone. This is another device to carry. But for civilians in an event like the Ithaca Festival, the Special Olympics, all kinds of things we have, this is a great device to hand out and say, okay, channel 1, you can talk to these people, channel 2. So that's what we're doing. I think, again, you should be very pleased that we were able to accomplish this. It's a great contribution to the Special Olympics. I think Mike's excited about it. I'll let him talk a little bit about it, but these devices are worth about $20,000. They're just loaning pretty
Yeah,
good.
I was doing the math in my head.
Yeah.
It's impressive.
And the accounts for 1 month are about $228, which is pretty cheap to do what they needed to do with a very expensive device that doesn't do much different, you know?
Yeah.
So anyway, that's kind of and I'll let Mike, or answer any of your questions that you might have.
Yeah, go ahead, Mike.
Well, no, I just wanted to emphasize that this device connects directly to ES Chat. So we just recently learned about this. So we're excited about it because of the cost. We could have a cache of these on hand to use for these various community events, as opposed to continuing to keep a cache of these just because of the price. So it is very exciting. And in speaking with a partner at Cuba Medical Center, they are currently on our 800 system, which means they have to have one of these radios. So they don't really have a choice right now, but to purchase a $3,500 radio for every member of their team that needs this. But because they're in a controlled environment, this could very well be a fantastic alternative for them, because their needs are slightly different. So it could be a significant savings. So any of our partners, and we have many that are on our 800 system that are currently using this or aren't doing public safety, could maybe transition to this and save tens of thousands of dollars. And we're excited about beta testing this next week with the Special Olympics and seeing how reliable it really is, and seeing if this could be something that we recommend to those non-public safety departments that are utilizing our 800 megahertz.
Okay. So this is really good news.
Yes.
All right.
Harlan for all his.
Right. Why don't you stop screen sharing so we can see who's here, and I would open up if you have any questions.
I'd just like to remind everybody to use your microphones, please, so that the people at home can hear us.
Certainly, we're fortunate to be hosting the Special Olympics, and this is a really good thing. I know that there's a call for volunteers to come up and help. And I appreciate the support from the public safety aspect of it. So that's great.
There's one other thing I forgot to tell you.
Yes,
I know
please.
you're interested in, and that is that at some point in time, some of the fire departments that border other counties have been looking to get the county to possibly buy some much more expensive radios, multi-channel radios like $6,000 or $7,000, to be able to communicate with their bordering, say Dryden with Virgil Fire Department, or Cortlandville, Trumansburg with Covert and Schuyler County and so on. This ES Chat system will allow us, with the proper thinking and working with them, to be able to solve some of that problem. And is it okay to?
Absolutely.
Yeah. So we are, Mike has made a command decision that we are going to implement putting an iPad with ES Chat in each of the bordering county 911 centers. We're going to start with Cortland County as a pilot, and that will give them reliable communications between our 911 center in Cortland County at almost no cost. And we're not asking them to pay anything. We will pay for, an iPad is relatively inexpensive compared to, a $7,000 radio. And the idea is to eventually have that in each of the bordering counties. So that's another visionary solution. I know you were interested in that too.
Yes, no, it's great, the innovative thinking on this. So certainly welcome a report as it rolls out and we see how it's actually working. That'd be great. So thanks for coming. Okay.
Can I ask maybe a silly question?
Yes, sure.
I was going to ask if you could connect to other counties. So that's exciting that you're working on that. Thanks for explaining this all. Maybe this is silly, but what does broadband device mean in this context?
It means it's using the internet. So this device is using a radio system with radio towers in the county. And when you get outside the boundaries of the county, depending on where you are, you lose connectivity. Whereas if you're using a radio that's up at the Department of Emergency Response that connected to the internet, that allows you on your phone to talk on that radio system anywhere in the country. So that's what a broadband device is. I mean, broadband is what you're using when you're connecting with the internet.
So like, is it the same technology that a cell phone uses if you're just,
Exactly.
okay.
Exactly. No, it's a fair question. It's the same technology. This is using microwave technology. We have a total of 11 microwave sites in the county, one of which is right up at the Dewar site where you were and visited. And then this is using cellular technology. So that's why it gives us that opportunity to communicate anywhere there's an internet connection.
Awesome. Thank you.
And I just add, one of the real benefits here is that you then get the redundancy that you can communicate on the radio or the cell phone. So if one system isn't working very well, hopefully the other one will be. So good stuff. Okay.
Rich?
Yes, Henry.
Oh, can I ask a question?
You bet.
What if you in the area where there's no internet?
Then you don't have any communications.
Yeah, it's still subject to
Well, you
living
have
in
to have,
upstate.
Yeah, cell coverage, yeah.
Right, because there's lots of areas in the county that don't have internet. And so I
Yeah.
just worry about that.
It's getting much better, Henry. So FirstNet, which is the nationwide public safety cellular system, has installed now 14 new public safety cell sites in Tompkins County. We are probably way ahead of most other counties, perhaps because I've been very insistent that they do that.
Okay.
But the fact is that, for instance, just recently, they installed a new public safety cell site out in Brooktondale. There was no coverage out in that whole area. And now the public, in addition to public safety, have coverage in most of that area. So actually, most people who have had experiences with dead spots, there'll always be some dead spots. But generally speaking, the county has got pretty good coverage now with that system. Depending on whether you're on Verizon or T-Mobile or FirstNet.
If I could just add, Henry brings up a really good point. And it's one of the reasons why we're emphasizing to our public safety partners about how they use this device, as far as not necessarily using it for primary communications and using that as really for redundancy. So it's a valid point. And we're hoping, though, as technology evolves, this could be, really the direction that public safety radio communication moves towards as well.
From a cost standpoint, it does seem like there's some real advantage if we can get it
Get
consistently.
better coverage, exactly.
Yes.
So I just wanted to emphasize that was a really good point. That's one of the reasons why we've taken the position we have with our public safety partners.
Anything else, Henry? Good. All right, anybody else? All right, let's keep moving. I had a couple other things I wanted to talk about on Chair's report. The first is that we will be meeting in July in a joint session with the Health and Human Services Committee. That meeting would be on July 18th at 3 o'clock. I believe that's a Monday, but I'm not looking at a calendar right now. And Dan Klein and I had talked about this.
Yes, it is a Monday.
Thank you. And I had proposed some possible agenda items for the two committees to think about in the same room. One was mental health services in the jail, and another is response to fentanyl and other drug overdoses. The third was developing a mental health stabilization facility to work in concert with the jail. And then any other items that we thought would be relevant to the two committees. And I'd invite anybody on the screen here or in person to propose topics, and we'll try to put them in. But for the committee members, do you still want to have a separate public safety committee meeting in July? We have a couple alternatives there. We could start a little bit early. We could stay a little bit late, or we could keep our Thursday meeting. I anticipate we may have some administrative business we'd want to take care of. So I'm thinking perhaps we could meet at 2:30 or tentatively plan to meet at 2:30 unless we just don't have any business or separate business. To the committee members, would it be okay to meet at 2:30 on that day? Any objection, I guess?
Have you checked with Dan about that?
We're going to meet with him at 3. Or are you thinking
Okay.
his?
Oh, I
committee?
mean, I chatted with him about this yesterday and his committee, our committee, most of this committee is on that committee too.
Right.
And so I wouldn't be surprised if each committee wants to meet separately to do other business. So I
But then
kind of
we-
like the idea of one committee starting early and one committee ending late, but you gotta have one of each.
Yeah, let's, if I could beg an indulgence, if we could try to keep it flexible, we'll either start at 2:30 or run a little bit late if we have separate business we need to take care of. Any objection to proceeding in that manner? I would rather not have a separate meeting on the same week on Thursday. Seeing no objection, I'll proceed with Dan on that basis, and we'll figure out whether we start at 2:30 or we stay a little bit after. The other item I wanted to talk about on Chair's report is I shared a New York State document on crisis stabilization units, and we'd had some prior discussion about trying to think about mental health issues at the jail. And this is one possible way to go. I was talking to Marty Stallone, the president of Hugo Medical Center, and he was indicating that the hospital has participated in a grant application with Tompkins County, and I believe some other parties, maybe Lisa, you know more about this than I do, to try to get some money for a crisis stabilization unit. What I would like us to think about is whether there could be a secure component, whatever configuration it comes out with, that we could utilize that type of facility for people in our jail. And I'm thinking we'd save a dramatic amount of money for everybody that we avoided sending to a state mental hospital. The per day cost is, I think, $1,100. Is that right? Something pretty high. And I think it also would address the idea of trying to have a comprehensive system. Say if somebody is in the jail that needs crisis stabilization, they could start there, and even if they were released, they could continue to get services as they needed them, so that we did not have any gap in service to these people. I'd love us to have further conversation about this subject, and I wanted to get that document out to everybody to just help explain my thinking. I'd welcome any reaction anybody has. Mike?
I mean, I'll start, I guess. I guess I didn't understand. So when somebody goes to the jail now, you're saying we send them to state for crisis stabilization, or we stabilize them and then send them to the mental hospital at the state?
I believe we're doing the best we can locally, and then we send them to the state hospital, but I'd take input from the sheriff on that.
Yeah, Rich and Mike, obviously, we all know we get a lot of people in our jail with mental health issues, also coupled with drug addiction issues. Yeah, I mean, we simply do the best we can. We have a nurse on site. We also have a medical doctor and a psychiatrist and our forensic counselor that all help address mental health issues in the jail. But that's it right now. So yeah, we could pretty much handle most issues ourselves currently. But if it's beyond sentencing or anything like that, obviously they may end up somewhere else. So yeah, I think it would be helpful for sure to expand upon that in our facility. And would be open to that discussion.
And Sheriff, was I in the ballpark on the per day cost whenever we have to have somebody go to the state mental hospitals?
I think so, Rich, but I'm not positive. I'd have to check on that.
Okay. All right. Any other comments, questions? Mike?
I would actually go even bigger than what you're suggesting. I mean, we've talked about this, that
Okay.
I'm in full support of the Crisis Intervention Center, as we've talked about. But I mean, I would actually hope to partner with, and I saw Marty today and brought this up to him because we had just talked about it. And, you know, if that means we need to build a mental hospital in Tompkins County, I could see support for that, to be honest with you. And I would support actually pulling people off the street who need that and doing involuntary treatment. So that's kind of where I'm at with it. I don't know where other people are.
Well, certainly, I support what you're saying there, Mike, as well. What I'm thinking is that we would want is a seamless connection that if somebody is going through that and also has criminal charges pending such that they're being held, that there would be a secure component to a facility so that we could hold somebody in both jail and the crisis stabilization unit at the same time.
Well, be careful
Yeah.
if you're going to be in full support of the involuntary treatment. A lot of people may not be for that. I mean, I personally
Yeah.
am, but
Yeah,
other people
well,
are, so.
I mean, if they need it, then there's people far more knowledgeable than me on that, but, okay. Lisa?
Just a question. How would these services interface with what is being developed for crisis stabilization services with the Alcohol and Drug Council and their clinic on Trip Hammer Road?
Yeah, I think that's what we need to talk about, whether it could work and if so, how would we do that? And also look at whether it is financially feasible. I believe we're at a point we probably need to think about investing some significant new money in making sure we're addressing this issue appropriately. But obviously that's a point where we can have argument. I see Frank is with us. Frank, did you have any comment on that?
I was just going to jump in and I think answer Lisa's question. So if the question was, how does the new crisis stabilization proposal work with the Alcohol and Drug Council's plans for the Lansing facility? They are part of the team that's been working on putting the proposal together. And we would expect that both would work together, but recognize that the Alcohol and Drug Council's system is designed for people with substance use disorder. The crisis stabilization grant that was applied for was for those with mental health and substance use. So it's co-occurring. Unfortunately, the systems are still separate, right? And so we're trying to come up with a local solution by partnering to be able to address both effectively. But the component that the hospital applied for is focused on mental health, while the Alcohol and Drug Council's is focused on those with substance use disorders.
Yeah, just to put my view out there, I think the dual diagnosis issue is where we should be heading, to try to make sure we're capturing addressing individuals that are suffering in both categories. Yeah. Anybody else? Yeah, Veronica.
Thanks for bringing this up. I don't really know enough to opine on it, but I'm interested in learning more about the grant that was applied for and thinking more about this. Because I think it would be great if we could provide people the services and treatment and location locally instead of sending them off somewhere. And would probably be in favor of investing money in it. Mike, as you expected, you totally lost me on the involuntary commitment thing. But we can discuss that another time.
Well, I think what Mike is bringing up is that there's a lot of questions on how do you hold somebody who doesn't want to be held but is clearly suffering through a mental health crisis. And the New York State law on that is somewhat complicated. But I anticipated our July joint meeting with HHS, we might have a further presentation on this issue. So the document I shared with committee members is a prelude to that. So, okay. That's all I had. I would move on to county administration. Welcome, Lisa.
Thank you, Rich. Today we have an update on reimagining public safety. Unfortunately, Mona is not able to join us today, but we do have Deanna to provide a brief presentation and a swan song presentation to public safety before she leaves the camp. So I'll yield my time to Deanna.
Thank you, Lisa, and I'll make it brief. And also, Matt was here to be a part of the presentation, but he is in New York City right now as a part of some work he's doing, so he had to step away. So Matt sends his regards, and if you have any questions, we will move forward. But Lance is here as well, who will be working collaboratively on this plan. So I'm going to share screen quickly with you. Can everyone see my screen?
Yes.
Yes, thank you. We are here to provide an update on the public disclosure plan here related to reimagining public safety. My screen is not advancing like I'd hoped, so I'm going to try again.
At least you know that your government does good things.
I think it may be working now. Try again. Can you see my screen now? Well,
Yes.
best laid plans. Screen is not advancing again. I'm trying to see if anybody can help. I've had this problem earlier today, so I'll just
Deanna,
talk.
have you tried just clicking the actual screen instead of?
Yep.
Okay, I'll
There we
pull it
go.
up for you. Just give me a minute.
Hold on, I'm going to go back and try again. I've had a couple issues with this file today. Yep, I'm just clicking. Revamp. We're going back. Okay, I think it's working now. Is it working?
Yes.
It's perfect. All right, so our charge, as we always talk about, is trying to, again, localize our work in terms of disproportionate minority contact related to reimagining public safety. Reimagining public safety, our work is to reduce racial bias in our systems of community safety. We also want to, again, promote community engagement, but more importantly, at the heart of everything we think about and do is fostering trust, fairness, and legitimacy through transparency. And again, I'm going to say that one more time: fostering trust, fairness, and legitimacy through transparency, because that's what we're talking about today in terms of this plan. And again, we've already discussed, our work in terms of creating a community justice center and the other areas. So one of the plans that is a county-specific plan that the legislature passed last year was the requirement for public disclosure of district attorney and assigned counsel office statistics on a quarterly and annual basis. One of the things we heard loud and clearly through the process is what happens with information once an arrest or occurs, or what happens throughout the process, and knowing that the community, that the criminal justice system it's a large construct. There's a continuum of services and there's a continuum of process that people experience. And so understanding what this information means and what data is collected is imperative for us to move forward and be successful. So the process goal for this plan is to increase transparency and accountability by sharing information publicly and quarterly. So specifically around demographics, I think it's been acknowledged by the county multiple levels that we don't collect a lot of demographic information, but we want to do so. Looking at case dismissals, prosecutions, deferred cases, and then also additional information other than what has been traditionally thought of in terms of our data collection process. We want to develop a comprehensive set of data through community input, learning what our community members are interested in understanding about the roles between our assigned counsel and our district attorney offices. And so from there, we will create a public display of that information. In terms of the framework, what was approved by the legislature in the past, we are recommending a resolution mandating that this information be reported publicly. And then also, again, some of the mandatory reports in terms of demographics is important, but also us collaborating with CJTI in the work, knowing that CJTI has been a bedrock in terms of the work, some of the things we've done in the past in terms of being informative to the community. The assessment process is how do we understand the work that has been done in terms of our systems and what's available. We collaborated with Measures for Justice on coming up with the report, specifically you'll hear more about today, but part of our overall process will be reviewing the district attorney data and assigned counsel data. Then also, the county has the results-based accountability tool that all of our departments use. And so understanding what that looks like. Also reviewing our records management system, but then also looking at other communities, what information is available, what communities are best in practice in some of these areas, and identifying where the gaps in data are and what we collect and what we'd like to know. So I believe legislators received a report this morning from Measures for Justice. The county solicited this report several little more than 6 to 8 months ago. It's specifically around the district attorney's office data capabilities. The report shows what's going well, what are challenges, what opportunities for growth persist, and then also how do we move forward. Specifically, the report calls for more transparency in terms of our data, but also specifically creating a data infrastructure. We believe we're in line with where the recommendations are headed because the county will be investing in hiring a data analyst. So having someone there who has the knowledge, skills, and abilities to be able to collect, extract, and also help translate what the data means. But also when we say translate, how does the community understand what that data, what the data is saying? In terms of what is going well, there's consistency in the data and that they have clerical staff who consistently put information to the system. It's done in a timely manner. We know that there's a solid knowledge foundation in terms of the data that exists. So there are also proposals in the report for what the office can do to address these challenges. Again, they're recommending work with the data therapist, again, to move us to the next phase, but then also creating some kind of shared language and definitions around what data we collect. And so there's a lot of work to do, but knowing that this is a good start to where we intend to land. As a part of launching this particular plan, as we always have as planning groups. And so again, as we talk about centering equity in our work, we always list and making sure the community is at the heart of everything we do, making sure there's representation from our underrepresented populations, but also our district attorney's office as a key stakeholder, our assigned counsel department. We would also appreciate support from the sheriff's office, as we always do, IPD, our ITS services. In addition to that, we'd also, we will be looking to Dominic Recchio, specifically our county communications director. And then again, this plan is around public disclosure. And so as our lead public information officer, he will have a key role in leading this work. Also, one thing we've heard resoundingly is how victims advocacy services interact with the Reimagining Public Place Safety plans. Also, we would appreciate partnership with our law enforcement assisted diversion program and again, our New York State Police. And so we believe that these key stakeholders will be critical to the success of the work that we're doing. Once the plan is developed and implemented, it will be dissolved, but knowing that there will be next steps from there and there will be other items to be implemented. So the milestones to be looking forward to, we'll be formalizing the group by the end of, the beginning of July, making sure those invitations are there, but then also September 2nd, making sure we have evaluation criteria because we want to make sure that we are meeting the goals of the specific reimagining plan. And that is to increase accountability and to increase transparency in how we share our data. And then by the end of the year, we will finalize all of our metrics that we have in place to make those recommendations, identifying which tools, what display, what it will look like. We've talked about a dashboard. We talked about other tools we can do as well. And then a report will be compiled with recommendations for support in the future. Today, as we mentioned before, we spent $1,500 on the Measures for Justice report to get an initial assessment. This assessment was discussed over the last 5 to 8 months with the legislature off and on, again, waiting for the support. And now we have the information that we need to move forward. We are really looking forward to having more information from what happens to the assigned counsel in their office. They have a more advanced data process. And so they were able to maybe have a better sense of some of that information. So we look forward to compiling and sharing that information as a joint effort. So what's next? After the recommendation is provided in February, we'll come back to legislature with recommendations of whatever that may be, and we will request approval. And then once we receive that policy guidance and recommendation, we will move forward. With that, I will stand for questions and I will stop sharing my screen, knowing that, again, there were 2 documents that were sent to our colleagues, including the full process overview, in addition to the Measures for Justice report. So stand for questions.
I have a question. One of the recommendations is for a data analyst. And I assume the position that had been contemplated for the Community Justice Center, this could fall under their responsibilities. Is that right, Lisa? I see you nodding.
Yes. Okay. That's the intention.
All right, anybody else? Okay. Well, Deanna, thank you for the report and thank you for your efforts. The committee wishes you very good luck in your next endeavors.
Thank you. I appreciate it, sir. And then just two quick, another Reimagining Public Safety update into the efforts that we'll be doing a town hall with the unarmed pilot program with the Sheriff's Office next Tuesday. And so we're encouraging all of our community residents to come ask questions about what the pilot program is, ask us difficult things, ask us push us to the next level. We want to measure success in that program. And so we're really looking forward to that. And thank you, Sheriff Osborne, for your collaboration on that work. And so we're looking forward to it. And thank you, Rich, for your kindness.
Okay. All right. Moving on, our next item is the Sheriff's Department. Welcome, Sheriff. And Jen Olin as well, Under Sheriff.
Thanks, Rich. You have our report. You also, I believe last week I sent everybody a digital copy of our annual report for 2021. I hope everybody got that and had a chance to look it over. If not, please do, and let me know if you have any questions on anything in there. To expound on what Deanna just mentioned, yeah, our sheriff clerk started this past Monday. They're in a training phase right now. They've learned how to use our records management system somewhat, Spillman. They were also this week spending some time with our road patrol deputies on the road. They're going to spend some time at the dispatch center with dispatchers before they come back here and work even harder to learn what their jobs are. We want to give them that exposure to kind of understand how the big picture works with all the agencies interacting with each other. Gun laws, I also sent everybody, I think, on the legislature, some of the new proposals or bills that have passed. At some point, I'd like to have a discussion about the licensing requirement for semi-automatic rifles. Not a lot of information was provided on that, at least that I've seen. But it looks like from what I'm hearing from the Sheriff's Association that semi-automatic rifles are going to have to go through a licensing process just like our pistols do. And as you know, the Sheriff's Office handles all pistol permit applications. Obviously, if that's the case and we have to set up a separate licensing regime for semi-automatic rifles, that's going to be very staff intensive, and we'll have to discuss how we're going to even possibly accomplish all this. So yeah, a lot of good stuff came out, but as usual, not a lot of direction for us to follow or know how to enact any of this stuff. So I expect to have more discussions on that as time moves forward. Last thing I got, we talked last meeting about touring some other local jails. We didn't get much response back from committee members on availability, which I know it's tough, trying to set up a date that so many people can go to something on the same date and time. But if that is still something that committee members want to partake in, I'm certainly willing to set that up if we could just get on the same page as far as dates and times.
I would suggest that they do a doodle poll as opposed to, because it was a wide open email, and I in fact emailed today, and that basically you pick times and then we respond to those times.
Yeah, I'll have Megan get everybody out a doodle poll if that's you think that'll help everybody. Certainly,
I think it will.
Okay, thanks, Henry.
And Sheriff, I think there is continuing interest in trying to get over there and see what they're doing.
Okay.
Yes. I did have a follow-up on one of the things you were mentioning, the gun safety issues. And I know you were recently involved in some local incidents where fortunately situations were discovered ahead of time. And I was wondering if you could just talk to those situations a little bit on the process of how they were discovered, and if you think there's any kind of local process we should be trying to formalize to try to address the issues early.
Yeah, absolutely. No, I think in the situations that we were involved in, which were two, both with the Lansing School District, the process went very well, in my opinion. I think the school did a great job separating people in getting involved early with the information they received. They notified us right away. And, you know, I couldn't ask for anything more from the schools for sure. I thought they did a great job. So yeah, I don't think there's anything I could come up with how to jump on these things any earlier. It's all about communication and how well each particular school does with notifying us and cooperating with an investigation. I know that Governor Hochul also recently put out Executive Order 18, which Lisa is well aware of, on how to best respond and confront, or identify, respond and confront to domestic terrorism incidences, which a school shooting would certainly fall within. And we are working with a group of us to try to come up with some kind of plan right now, which honestly, in my opinion, at least when it comes to the sheriff's office, a lot of the stuff's already there. It's just putting it all together in one document is to make a plan. So yeah, I think that'll be helpful.
Do you anticipate there being some sort of public education component coming out of it?
Yeah, we've had that discussion as well. Dominic was part of that, and we discussed trying to do something maybe over Zoom or Facebook Live. I think that would certainly be helpful, and I would certainly hope to be a part of that.
Okay, Henry.
Yes, I'd like to shift for a moment about the safety of people at human services buildings. I know that you're involved, although I know that is also in the city. And so can you explain what the relationship is and what steps you're taking?
Yeah, I had a discussion with Lisa and toured the building, I think a year ago. And we've had discussions in-house regarding that. The way it works right now is typically police calls that happen on the property of HSB or around it are handled by IPD because it is in the city. We would certainly go down and assist them if needed, but they usually don't typically need us to respond to help them. As you probably, I think you are aware, after the two incidences down there within close proximity with each other, we did set up an overtime detail and had 2 deputies down there every day during normal business hours for a week, a full week. And I think that was extremely helpful to people there. The feedback I got that from people that worked in that building, that they never felt safer, they were grateful for it. It's just something, you know, right now we can't currently sustain with staffing at the levels we have them now.
Okay. And I'd mentioned at the beginning of the meeting, if Jen, you're willing to tell us a little bit about your training with the FBI.
Yeah, sure. So I was part of session 282. The sheriff was part of session 231. Not quite sure how long ago that was. I won't ask him.
Way to rub it in.
So there was 254 of us in the session. We represented 46 different states, including the District of Columbia, 26 different countries, including 4 military organizations, as well as 9 federal organizations. Out of the 254, there was 26 women, and we all got very close, made very good connections. My particular roommate was a captain from the Baltimore County Sheriff's Office. She was very helpful. I've got a lot of her policies, which I actually forwarded over to Deanna and Derek during it regarding their mental health response and their core response. So I feel like I made connections that are going to be very beneficial to the Sheriff's Office, the county, and the community. It was a 10-week program that pretty much concentrated on advanced communication techniques, leadership, and officer wellness, which are, you know, all things that the Reimagining Public Safety initiatives include, as well as the Sheriff's Office vision and mission. So it was a once-in-a-lifetime experience, and I really appreciate the sheriff and the county allowing me to do it. And I think it's going to be very beneficial. And I'm looking forward to using the connections that I've made to benefit all of us. And if anyone has any questions that if I can answer them, I'd be happy to answer them too.
No, thanks for telling us about it. And I think it's just great you got a chance to do the opportunity. So, okay. Sheriff, you have a resolution we should take care of. This is appropriation from contingent fund, replacement pay, and terminal pay reimbursement. Doc ID 10977. Could I get a motion on that? Veronica moves, Mike seconds. Do you want to speak to this, Sheriff?
Yeah, I can briefly, Rich. It's pretty routine. As some of you may know, we do these a couple times a year. Per county policy, we have the opportunity to recoup budgetary costs expended when people leave, either to retire or are out on extended, I believe, 207C or disability. And we have people out for that reason. Money expended, we can recoup it through the contingent fund.
And just for the benefit of anybody who's watching at home, and I always get them confused, the difference between disability and 207C.
Yeah, disability is any type of medical issue or health concern, non-work related. 207C is a work-related injury or illness.
Okay, thank you. All right, any questions or comments? Are we ready to vote? I'll call the roll. I'll start on the screen. Travis.
Yes.
Henry.
Yes.
Mike.
Yes.
Veronica.
Yes.
And the chair votes yes. So that passes. Okay, anything further for the sheriff? Any questions, comments? Okay, thank you very much. And we'll move on to the district attorney, who I believe is not with us today. So we can get a report next month. And we'll move on to Department of Emergency Response. Michael, welcome.
Thank you very much. I appreciate it. Just a couple of things I want to bring to everybody's attention that's not highlighted in the report. First thing, I just want to express my gratitude towards Henry. He picked up on a typographical error on page 22 underneath the number of 911 calls. We had documented 2,161 calls were answered between 0 and 10 seconds. That number should actually be 3,161 calls. So Henry, thank you very much. The other thing I wanted to just bring people attention to is page 24. We're starting every month to highlight some successes in the 911 center specific to activity that the dispatchers are involved in. Specifically, there's 2 calls involving CPR instructions that resulted in a favorable outcome for the victim, 2 of which were both discharged from the hospital. And then another unique call where a dispatcher worked with law enforcement and a third-party caller to help try to identify the location of a suicidal camper in the woods that was seeking help. So we're going to start adding those to our TomStat reports. The other thing I wanted to bring to the group's attention is a colleague of mine, Justin Van, and I have been sitting on an EMS subcommittee through TCOG. I recently spoke with Rich about this to bring him up to speed as to some of the topics that have been discussed during those EMS subcommittee meetings, specifically 2 studies that were conducted since 2016 to present that are looking at the gaps in the EMS system in the county. And our role within the Department of Emergency Response is to work with various community leaders to identify opportunities and what opportunities may exist to enhance our EMS services in the county. So I'm very excited to be part of that, and more to come as that evolves.
Yeah, and just to add to that, in our conversation, I suggested to Michael that we might spend some time talking about this at our August meeting.
Exactly. And if I could just congratulate Jen on her accomplishment, I think that's fantastic. So thank you.
Okay. Any questions or comments for Michael? Henry.
Yes. Can you give me a status update of the text to 911 process?
So that purchase, so we are acquiring that as part of our 911 center backup project. So we have purchased the module, and some of that will be rolling out towards the fall. So I think the last time we spoke, it was still in the discussion phase. It was something that I know that was talked about prior to me coming on as a team member, but I'm very enthusiastic to report that we're much closer now. And that is, we've purchased a module, and that will be developed and rolled out internally as part of the larger backup 911 center project and the renovations to our existing 911 center. So we're hoping to go online with the new 911 center backup center in December.
Okay.
So I'm sorry, I had to move the microphone a little bit closer. But some of that software, the newer software, will be rolling out in the fall. Another example of a software package that we purchased was a dictation software that will be recording in real time and converting to text the call that's in real time between a caller and the 911 operator as well. So that's part of that module, Henry.
Okay, thanks.
And if I could just ask you for a brief report, one of the things that the emergency response does is tracks where all emergency vehicles are. And they do that so that they can see where the vehicles are to get the closest responder, and also for the protection and safety of the emergency responders. And for technical reasons, the city police vehicles were not visible. And I know that there's been tremendous effort to work through the technical aspects. And if you could just talk for 1 minute about where you're at on that.
Yeah, absolutely. I'm excited to report that we're probably about 90% to completion on that project. So again, thank you, Rich, for helping us get this into the end zone. Right now, the city has begun to reinstall some hardware. They've been working through some configuration needs, and they've been working with our IT team. And collectively, they've partnered and figured out a no-cost solution to get those units back online. And so I'm really excited about that. And it is my hope that next month, I'll be able to report that they're fully up and running.
All right. Love to get that report. All right. And you have a resolution. Authorization to enter into an agreement with T-Mobile Northeast LLC, tower co-location at the Public Safety Building, doc ID 10976. Could I get a mover and seconder on that? Veronica moves, Travis seconds. Okay. Michael, do you want to speak to this resolution for a moment?
Yeah, absolutely. So we've actually had an agreement with them for over 10 years. The reason why we re-entered discussions with them is that this particular tower is at the Public Safety Building and is behind a secured location. And a few years ago, it was determined that if T-Mobile ever needed to come and actually do work on that tower, that they would need to hire somebody from the Sheriff's Department to provide security and to ensure that, that work could be done in a safe manner. T-Mobile really didn't want to do that. And, this has been going on again. Actually, this is going on almost 3 years now. So I've discussed this with the sheriff. He entrusted me with helping to get, again, this into the end zone. We were able to do that. So really, this is just a modification to our existing agreement. But this now ensures that in order for T-Mobile to come onto the public safety property to service that particular antenna, that they have to communicate directly with the Sheriff's Department and hire the necessary security to work in that safe zone.
Okay. Any questions or comments on the resolution? Are we ready to vote? Call Travis?
Yes.
Henry?
Yes.
Mike?
Yes.
Veronica?
Yes.
And the chair votes yes. So that passes. Okay. Anything further for the Department of Emergency Response? And again, Chief McEwen, thank you for your presentation. That's really great work. Good stuff. Next up is the Department of Probation and Community Justice. I see Dan Cornell is with us. And is Carla there? Yeah, and Carla. And before you begin, I know this is actually a book club, masquerading as a public safety committee, but I did get this book, Dan, and just finished it. I would recommend it to anybody who is interested in basically criminal justice matters in other countries. It makes me very happy to be an American and seeing how basic due process and, ethics and corruption issues are treated in Russia is just terrifying. And it frankly makes what's happening in Ukraine right now not that much of a surprise, that there's a very different way of looking at the world. But thank you for the book recommendation, and I enjoyed it and I recommend it to anybody. I'm happy to lend it to anybody who wants to pick it up. With that said, Dan, welcome.
Thank you. I'm glad you liked the book. I wanted to update everyone, if you haven't heard already, the Clean Slate Act was not passed by the state legislature prior to the closing of their last session. I don't believe that's going away, but it's possibly going to be brought back up when they resume legislating in the fall. So we'll keep our eyes on that and keep updating you as far as the impacts that may have on our department. Wanted to thank Mike and Chief McEwen for the ES chat presentation. I've seen some of it before, and probation does remain interested in that. When you're able to get to us and thinking about it, I think it would have really expedited our communications on May 27th, when it was necessary to communicate with multiple people at the same time with limited staff. So I think it would be very helpful in that way, as well as in just our day-to-day communication with the probation officers when they're out in the field and in the office. Lastly, I just want to thank Sheriff Osborne and County Administration for the 1 week detail at Human Services Building. It made a huge difference for people. It was very much appreciated by staff and clients alike. And thanks to you and your staff for dedicating that time. I know a lot of those men and women were basically working doubles in order to help make us feel a little bit safer. So I appreciate that very much. Other than that, I don't really have any updates today.
Some stuff going into the chat from Frank, but I can't open the chat. I'm not sure what he's telling us there.
Sorry, I didn't mean to interrupt the meeting. I just wanted to share that we added the overdose calls from the Tomstat report to our opioid resources webpage at the health department. And so you can go to that link there and see the last 5 years worth of those calls in a graphic form. And Mike and his team have been very helpful in getting us that information. So we'll be updating it each month.
Oh, thank you so much. That's great news. Okay. Any questions for Dan? Veronica.
I have a question that's not really about anything you said, but just because it looks like we have some time in the meeting. Every month, and I appreciate this, you give us this monthly summary of jail bookings and what's the other one? Monthly snapshot of enhanced sentencing and supervision options. And it's a table with lots of numbers, but I don't really understand what it means. Could you like explain, stop me if this is not appropriate, but can you like take 5 minutes to explain the rows in the table?
I'd be happy to do that. I think it would be easier if maybe next month I bring that up on the screen so we can all see it and I can go through it and answer any questions for people, if that's okay.
Sure, yeah.
No, that's a good idea. And I apologize because you're new to the committee that we take that for granted. It's just all the data coming in. I did see on that report that the use of electronic monitoring is relatively low, that you have not had a lot of instances of it. Is that because of the bail changes?
I believe that's related, but a lot of the cases that we do get on electronic monitoring are people who may otherwise have gone to jail prior to bail reform. We're getting some relatively serious allegations against the people who are getting electronic monitoring because they're not eligible to be incarcerated. Several of the people that we have on are on for gun-related charges. Prior to bail reform, those folks most likely would have been in the jail awaiting further action on their cases. So it's bail reforms had a variety of impacts, but I don't think it's reduced EM usage as much as it's changed who's getting to use it because of you have to use the ladder of least restrictive through most restrictive. And the people who are who need the most restrictive are the people who have the most serious charges alleged against them.
Okay. All right. Anything further for Department of Probation? Okay. Thank you, Dan. Carla. And then we're up to the assigned counsel program. Welcome, Lance.
Good afternoon, everyone. I apologize. I was a little late. I'd gotten bogged down on some court stuff in Schuyler County that ran long. And I didn't even get a speeding ticket from Derek coming back. But let me try to be quick here. A couple of things. First off, I believe I've mentioned this already, but I'm trying to make sure I advise everyone so they know. July 1st, as some of you at least know, Julia Hughes, our longtime program coordinator, my deputy, is retiring from service to the county. You know, she'll probably carry on a little bit as a transition part-time in July, but really retires effective July 1st. It's we've tried to undermine and keep dragging her back as long as we could, but you know, I think, well, it's about 25 years she's done her time in the system. So, but I want to make sure you all were aware of that on that. Just a quick kind of update on 18B rates. Nothing has happened. It had gone back out in the legislature right at the end. They had it on the floor. They pulled those bills. In terms of the lawsuit in the city, there's a lot of back and forth on a temporary injunction. It's clear the one blockage on a change in rates is coming from the executive, who says they want to increase rates and then are trying to block it right now as much as they can. Some of the thinking is it's going to be interesting to see in the fall, post the November election, if a number of things suddenly pass and move through, one of which is 18B rates. I think, Dan, the same thing may apply to clean slate. That may be the trigger. The sense is there may be a number of things. I'm perhaps not being fair to the executive, but this is the sense I think at least chief defenders have, is a number of things they don't want on budget and so forth pre-election are suddenly going to get resolved post-election. When the legislature is back in session. So we'll watch that. I think, Dan, same with clean slate, try to keep you updated. Same with like the crypto bill. I suspect, you know, our Assemblywoman's bill may get resolved post-election one way or the other. But certainly in terms of public safety, there's some things sitting there, and some of the thinking is for better or worse, some of those resolutions may come at that time. So we'll try to keep track of that for you. I've got two other things. Just a quick update from our perspective on LEAD. I mean, good news. Getting from the defense attorneys, implementation's going very well, being very effective. I think one of the limitations now is you know, they have caseworkers trying to add the additional caseworkers is limiting the ability of the program, but that's a good problem to have, trying to keep up with the demand. It seems, you know, participants from all sides are being active. You know, there's some guy at the head of it that, you know, people have a question mark about, that he's doing too much work, but I'm not sure who that is, but it's no, everyone is pretty happy with how implementation is going on that, even though it's right now kind of a city program. It affects some of the county departments, Matt's office, my office, you know, potentially Dan's department as well, downstream, you know, people who aren't ending up, people who otherwise wouldn't get diverted could end up, you know, straining all of our departments in terms of cases. That's going well. Having giving you the good news is now I'm going to aggravate you all because I have some strong concerns I want to speak out about the reimagining process and what's been occurring from my perspective. I think Rich is right. The city moves at its own pace. My concern has been, well, I have a couple, and I'm going to keep some of my private opinions, try to keep it out of it, but I was very concerned with the allegations and so forth being raised that there are at least inferences being tossed around.
Lance?
Yeah.
If I could ask, as I'm wearing two hats here, I'm the
Yeah.
chair of the Public Safety Committee, but I'm also the chair of the Ethics Advisory Board. And if you're going to speak to the ethics issues, I should probably step away.
I had one thing to note on that I don't think's improper.
Okay.
And I'll note at the beginning so you can decide. The feedback, and I think you intend to do this anyway, and I have sympathy, let me say, for the 4 citizen members of that board, probably not what they signed up for. But the feedback I'm getting from my attorneys, our clients and so forth is whatever findings you find, and I don't know what those are going to be, the more transparent you make that process to the degree you can, the better, because otherwise people are going to complain one way or the other. I think you're aware of that, frankly. But I just wanted to let you know I'm hearing that. I suspect other people are as well. In terms of the reimagining public safety, well, if you want to be safe and step away, Rich, I don't want to put you in a difficult spot.
No, I can speak to that, Lance, because the Ethics Advisory Board met last week in public session. And one of the things that I said was that we hope to be as transparent as we possibly can be. And the other 4 members seem to be completely in agreement with that. So we're going to try to have as much public visibility to each step we're taking, other than our actual deliberations. But all of the information I anticipate will come out before the public.
Okay. The other thing I wanted to say, which I don't think impinges upon that, was, and like I said, whatever the city does, but I was frankly offended and concerned whereby it seemed by inference or implication, people were trying to draw aspersions about the joint county city process that we were involved in. The law, I was part of the law enforcement working group with many of these people, and we spent months involved and heard all sides. For instance, it was Chief Nair who identified that IPD could probably 1/3 of its cases could be handled by non-uniformed unarmed responders, for example. But there was a lot of, I think, full discussion. And I think people worked very hard about that. I never heard a peep from anyone that there was anything improper about any of the participants or what we were doing. So I was concerned as a county department head in having, our county process by inference having negative, inferences raised about it. And I take strong umbrage to that. I mean, I have my personal views about what's going on. I'm not going to throw those out there, but I just felt it important to note that, people are raising complaints. None of those complaints were raised during the process about what we were doing.
Lance, I think I would feel more comfortable if we could have me not here.
Okay. Yep. And that's why I raised that. Yeah, no, and I can kind of leave it there, Rich, if you want. And I'll take it up with, if people have questions, I'll respond individually to them. I don't want to, I'm kind of conscious, Rich. I was hesitant at first.
Let's move on. Let's move on.
That's what I was trying to get to. Yet, people reach out to me if they have questions and move on, because it wasn't my intent to make it difficult for you, Rich.
Thank you. Okay. All right. Anything further that you wanted to report on?
No, I'm sorry. I thought you were speaking to everyone. No, I'm done. I'm going to mute myself. I'm done.
Okay, well, you talked about several different things. You were reporting on New York State legislation. Julia Hughes, do you have a replacement coming in to help you?
We're in the active interview review process. I mean, I was surprised by the number of applicants we had. I think we have some good applicants for the position, and those are getting reviewed. Interviews are in the process of being set up. So we'll have a replacement in place fairly quickly, is my anticipation.
I would certainly like to echo what you said about very long and meaningful contribution Julia's made to assigned counsel in our county. You know, we are fortunate in Tompkins County to have very good legal representation, both on the prosecution side and on the defense side. And I think the system of using our local attorneys to do the defense work has functioned very well for us. I believe Sigler County using our system as well is some testament to how well it's worked for us. And I hope she's going on to do something really fun. But yeah, she's really been a great asset to our county.
I think she is, and I'll pass on your thoughts. And I would just note for the members who don't know, most of that time that Julia's worked here for the county, the supervising attorney was a part-time position whose main jobs were not directly involved in running the program. And the program has a statewide reputation that's mainly due to her stewardship over the past decades. I mean, to the extent that, you know, I call it my program. Our program has its reputation. It's mainly due to her, frankly. You know, thank you for noting that, Rich.
All right. Any questions or comments for Lance?
Just to add, the lead program has hired their second caseworker. So we now have 2 caseworkers, which is extremely helpful.
Oh, thank you for jumping in, because I knew there was something else I wanted to ask Lance about, and it was lead. So how many people, Travis, at this point, if you could put on your other hat, how many people do you have under supervision and lead at this point?
16 under supervision.
And with the new social worker, you'll be able.
We'll gradually go up to 30 and kind of pause and then take emergency situations till we hit 40. And then in the meantime, we'll be looking for a third caseworker. Well, technically we're in year 2, so we'll be hiring a third caseworker when we find one.
Okay. And there is a direction of trying to include a broader geographic area. Is that correct?
The preliminary plan is to add, from conversations I've had with Deanna and Derek this past year, is to add the Lansing shopping area. So in 2023.
Okay. All right. Any questions for assigned counsel or Travis on lead, since he spoke up so helpfully? Okay, seeing none. Thank you. All right. Is there any other? Oh, Dan, go ahead.
Sorry, thank you. I had a question for Mr. Brooks. How long what's the length of time that you generally work with the participants in lead?
There's no maximum. You could have somebody in the program for 3 or 4 years. People don't max out based on a time frame. People leave the program based on success or if there's some unfortunate situations that occur while they're in the program.
Very nice.
So in other municipalities, they've had people in the program for 2 or 3 years. The idea, as long as they're making progress toward, things being better, then they stay in the program.
That's great. So you're not hampered by an arbitrary time constraints or anything?
No,
like that?
not at all.
That's great. Thank you.
Yep.
Okay, anybody else? Lisa?
This is on a completely unrelated topic to lead.
Okay, well, let's, I was just going to say, is there any other business to come before the committee? Lisa?
Thank you, Rich. So I was remiss under my report. I forgot to mention one item that is kind of a cross-cutting item between this committee and F&I, and that is over the last month or so, we have been digging into our capital program and some of the current projects that are underway now, one of which is the renovations at the public safety building. And there are expected to be some cost overruns in that project, ranging to probably a maximum of $600,000. So we expect, I've seen Norma is joining us on the Zoom, but we expect probably in the next month or two, honing that figure as much as we can and bringing something back to the legislature for consideration for further funding so that we can complete the project as planned in 2022.
Okay. I guess that's not unexpected with what's happening with construction costs generally.
Exactly. Just wanted to bring it to the attention of this committee.
Okay. Right. And then in continuing in the category of continuing business, Dan has indicated he could just give a brief review of what his data is meant to show us. Dan, did you want to do that?
Sure, I'm happy to do that. So let me share my screen here. Can you folks see the monthly summary of jail inmate new bookings?
No.
No.
Let me see if I put it on the other screen. Maybe you can. Can you see it now?
No. Oh. Yes.
Yes? Okay. I'll make it a little bigger. So if anyone has questions, please let me know. But basically, it's a month-to-month summary of how many new people have been incarcerated or put into new programs. So for Ithaca Wellness and Recovery Court, for instance, there was no one incarcerated for that program in January or February, but one person was in March. Again, none in April or May. Drug court sanctions for Ithaca Community Treatment Court, we had 2 in January, none in February, 4 in March, 2 in April, 1 in May. No family court incarceration. This would be felony drug treatment court or Tompkins County Treatment Court sanctions, 4 people in January, 0 in February, 5 in March, 1 in May. Fugitives in the jail, 1 in February, 3 in March, 1 in April, none in May.
What does that mean?
The fugitive is someone who's being held for another jurisdiction who can't be, we don't have control over when they get out. It's when the other jurisdiction comes to pick them up. So they're being held on warrants essentially, but the warrants didn't originate in our jurisdiction. Does that make sense?
Yes, thank you.
And then the folks that were held, so these are the people who were eligible for bail, but not given bail. They were incarcerated instead of being bailed or posting bail. So you had 9 in January, 15 in March, 11 in May, or 15 in February, 11 in March, 8 in April, and 12 in May. These are the individuals who were released month to month. These are the individuals that were being held that were prison ready. We've had none held month to month. Violations of probation, folks in jail, 3 in January, 2 in February, 9 in March, 5 in April, and 3 in May. 1 weekend sentence so far this year that was in February. People pending door to door, there were none.
What does that mean?
pending door-to-door to inpatient rehab. So they would be held at the jail until a rehab facility could be secured for them.
I guess I have a question, Dan. Why has it been 0?
I'm not 100% sure why it's been 0, because it seems to me like we've had people, but maybe they didn't last up there long enough to be captured on the monthly snapshot.
Dan,
Yes.
if I had to guess, I'm wondering if that's because a lot of times in order to get somebody in jail to go door to door, we also have to file a violation of probation. So I'm wondering if that number is actually being more captured by the VOP numbers.
That would make sense. Thank you, Carla. These are folks that declined to be interviewed for RUS. So none in January, 2 in February, 1 in April. That tends to happen when people expect to be convicted and just want to do their jail time locally. So they want the time pre-conviction to count. People being held for PSIs, those are generally folks who've been given an opportunity to come in here and be interviewed, but they've refused to do that. So we, after exhausting all efforts to get them in here, we let the court know that we were not successful in getting them in here for an interview. So the courts will temporarily house them at the jail so that we have a captive audience, so to speak, and can go up there and interview them. So that's happened once in January and then again once in May. Failed door-to-door treatment. So this is somebody who's been brought back after going door-to-door and then immediately leaving without successfully completing the program. We have 1 current. Parole violators, which is completely up to parole, 1 in January, 4 in February, none in March, 2 in April, and 2 currently. And then sentenced individuals in the jail, we added 2 in January, 2 in February, 2 in March, 3 in April, and 2 in May. Board outs from Cortland County were 0, and others were 0, 1, 3, 1, and 2. And scroll down to the asterisks, it's military AWOLs, bench warrants, rearrests on ROR, summonses, violation of Family Court Act or drug court, or day reporting revocations. So this is what we recommended during the same months for our ROR, RUS recommendations. In January, we recommended continue bail twice. In January, once in February, once in March, 3 times in April, and twice in May. Continue with no bail has been 0 throughout each month of the year so far. Release with electronic monitoring, we've had 1 in January and none since. Reduced bail recommendations, we've had none until this month. Folks who were ROR'd, 2 in January, 2 in April, and 2 in May. RUS's, again, 3 in January, 3 in March, 2 in April, and 1 in May. RUS to drug courts and RUS to day reporting have been 0, and set bail has been 0. So that it just gives you totals and percentages. I also have access, I could show you at a different time, but I have access to look at this in an Excel spreadsheet, and you can go back year to year and compare the numbers to see how they were pre-bail reform and since bail reform. If folks would be interested in looking at those, I'd be happy to do that at a subsequent meeting. Let's see if I can find the other. So this is our enhanced sentencing and supervision options, is what ESSO stands for. So these are recommendations that we made in people who were sentenced to different alternatives to incarceration for January through May. So in January, there were 8 pretrial RUS interviews, February 1, March 4, 6, 7, in April and May. Pretrial RUS again, or pretrial interviews was the first one. Pretrial RUS, we had 11 in January, 12 in February, 19, 16, 20. So the year-to-date average is about 16 a month. Year-to-date totals over here, 78. Pretrial RUS today reporting 4, 3, 4, 1, and 1. So average of 3 people being RUS today reporting. RUS contact is when they have to have contact with Bernadette Stranger, our probation assistant. So there's 2 levels of RUS. One is RUS contact is they actually have to come in and be seen, and then RUS, there's also RUS where they can just maintain contact by telephone. And the higher levels of RUS, if they're RUS to Ithaca Community Treatment Court or RUS to Felony Drug Treatment Court or Tompkins County Treatment Court. So we've had no one RUS to Tompkins County Treatment Court. We're averaging 5 people a month RUS to Ithaca Community Treatment Court. And then your pretrial electronic monitoring numbers, 6 for January, 6 for February, 11 for March, 13 for April, and 8 for May. Average of 9 a month and 44 EM cases so far this year. And then Wellness and Recovery Court, we've had 2, 1 in January, 1 in February. Scram's not typically used as a pretrial tool unless someone is pretrial RUS and continues to exhibit alcohol consumption. We can bring them back to court and ask for it, but it's not a primary go-to.
What is Scram?
Scram is secure, continuous remote alcohol monitoring. So it's a 24-hour-a-day ankle bracelet that people wear that does transdermally senses alcohol. So if you consume alcohol, some of that gets processed out through your skin, and this device picks up on that alcohol as it's being processed out and gives us an equivalent of a breath alcohol level. It's a great tool for incentivizing people to not drink. We use it a lot in the drug court programs, but also with DWI clients. SWAP is our community service program, service work alternative program. So we've got 7 new cases in January, 7 in February, 8 in March, 6 in April, 5 in May. And while we're on that subject, senior staff here decided to start a pilot because I think community service has been underutilized recently. So we're going to be sending out an email to the Magistrates Association indicating that our recommendation for people who are eligible and appropriate will be 24 hours of community service for any misdemeanor conviction and 40 hours of community service for any felony conviction to be completed during your 3 or 5 years of probation. I think it's a good restorative justice practice that has kind of fallen to the wayside since bail reform. So we're trying to reinvigorate that program and get the benefit of people giving back to the community. We've had great responses from participants in the past that they feel good about the work that they get to do and give back to the community as part of their rehabilitation. So we're going to do that as a pilot and see how it goes through the end of June 2023, starting in July of 2022. Greatest risk supervision. These are our people who score at highest risk levels for recidivism and violent recidivism. We had 36 cases on during January, 37 in February, 39 in March, 32 in April, and 33 currently. Electronic monitoring. So these are in addition to the pretrial release cases. These are people who are under supervision. So we're using it as a graduated response. We had 3 in January, 2 February, 2 in March, 1 in April, and 1 in May. So right now, the majority of our EM cases are pretrial. Again, since electronic monitoring is considered a highly restrictive graduated response, we use less restrictive graduated responses prior to elevating it to electronic monitoring. So our misdemeanor drug court program, we had 19 sentenced individuals in January, 20 in May, or 20 in February, 21 in March, 23 in April, 21 in May. We're averaging 30 people at any given time in the misdemeanor drug court. And again, for the felony treatment courts, 29, 28, 31, 31, 31 with an average. I guess I messed those up. Let me follow this over. So it's average of 21 misdemeanor drug court cases, an average of 30 felony drug court cases. The wellness and recovery court, we've seen that grow throughout 2022 into 2023. Originally, a lot of those cases were not probation cases. They were just being monitored by the courts. We've now picked up roughly half of the people in wellness and recovery court are also being supervised on probation as an assistance to the drug court model. So we're averaging 14 wellness and recovery court supervisions here at any given time. And then day reporting. These are monthly totals, 14 day reporters in January, 15 in February, 16, 13, and 19 for an average of 15 individuals a month who are in the day reporting program. So our supervision numbers, we're averaging 342 people, 332 criminal court cases per month.
Okay.
And so there's persons and cases. So it's 342 individuals, and some of them have more than one case. So it's 395 cases, but there's 342 people.
Okay, I can't see the screen, but I want to make sure if anybody has other questions. Did you have anything, Veronica?
Yeah. Thank you for explaining all this. I think I'm confused about how the number, like the total numbers add up.
For year-to-date totals, Veronica?
Was what I was going to ask is like, because it looks like it's just adding the people, like the numbers from each month, but are some of those, like, could there be an individual who is counted once in like every single month if they're in, like, is this a snap? What am I trying to ask? Could people be counted like month to month if they're like remaining in some program or supervision or whatever, say all the way through January through May?
Yes, these are not all new cases. So some of the people on greatest risk in January, these are not new sentences. That's the number of people who were being supervised at greatest risk, 36 in January. Then we added one. So some of these 37 are from the same as the 36. People tend to be in greatest risk supervision for 6 to 12 months, depending on their progress. So a lot of these individuals are carryovers. They're not new cases month to month in that category. It's also people can be in more than one program at a time. So you could be in wellness and recovery court and also on electronic monitoring.
Okay, that makes sense. And then
you could be in drug court and also on electronic monitoring, things of that nature.
thank you. And for at the bottom, for the numbers of persons supervised at the end of the month, those numbers look way higher than the sum of what's above them. So where do all the other people come from?
The other folks are all just on core supervision without any of these alternative to incarceration programs.
Okay, thank you.
So you could be on probation and not in any of these categories. You're just on probation.
Okay.
These are our graduated responses and pretrial issues. So the pretrial folks are not on probation yet because they haven't been convicted. And it's all these down here, the greatest risk, drug court felony, Ithaca Wellness Recovery Court, and day reporting. Those are mostly sentenced individuals or all sentenced individuals. I guess I could break it down further for you, and I'll try to be more prepared to do that when I look back, when I'm able to present the Excel version, and we can look back at how this looked in 2022, 2021, 2020 type of thing.
Okay, yeah, that'd be cool. Thank you. Worth reminding that this was completely on the fly and I didn't expect you to be prepared for this at all. But I really appreciate it. Thank you for indulging my questions. This is helpful to me and, hopefully to someone else out there thinking of what Deanna said about the value of transparency.
Absolutely.
So thanks, Dan, and thanks, Rich, for allowing this in.
Yeah.
Thank you for the question. I'm happy to meet with anyone individually too, to go over this in more in depth.
And Dan, I guess I'd add, I was happy to hear your comments about SWAP. I've always thought that was a valuable program and I appreciate the emphasis on it. And if you could stop sharing just to see if anybody else had questions, because I can't tell.
Let me try to get back there. Sorry, I can't open you up again. Where are we?
Yeah, if you stop sharing.
I'm sorry, for some reason I can't get to the place that makes me stop sharing.
Well, what I'd ask is if anybody has any questions, speak up because I can't. Oh, there we are. Okay.
Sorry about that.
Thank you, Brittany. Okay, any further business to come before the Public Safety Committee? Right, seeing none, I'd entertain a motion to adjourn and by a show of hands, you ready? Okay, we are adjourned. Thank you, everybody. We'll see you in a month.
Thank you.
Thank you.